the government then introduced an open door policy. Everyone could go and have the vaccine. So on day one, when it's available to the public, chaos happened. They thought, the government, that you guys would do it on an honor system. But did it happen? No. They brought the grandparents, they brought the 3-year-old and the 7-year-old brother, and brought the babysitter there. So it was a chaos. The lineup was 5 hours more in most centers. And the vaccine ran out the first day, like 5 hours into the operation. And there were complaints on the radio, complaints in the media, complaints everywhere, open line. And the minister got called every minute. So what happened? The government listened. They changed the policy. They started to do a daily briefing. It had never happened before. You never see a minister of health or any discipline giving speeches on a daily basis to be transparent and to know what the government is doing. They tell you statistics to calm down the fear. So they changed the policy saying that certain people have to bring in their certificate, your insurance, or your prescription medical card to show that you are really at risk. Now, once the government has more vaccine available, then they can give out a bit more. So gradually, they eased out their criteria. They improved their criteria to including patients that are under 65 years of age, have lung diseases, bronchitis, or asthma, and also to pregnant women who are in the second half of their pregnancy, which is 20 to 40 weeks. They also began to have the vaccine program in elementary schools or primary school first, because parents said kids need to be looked after. Half the classes were absent. I shouldn't be bringing my kids to school. And after hearing a lot of public outcry, the government acted, and they started to do kids. Also, the lineup problem, they acted on that too. They started to give out a numbering system that changed the whole ball game. You went there, you got a number, and told to come back in 2 hours' time. So the wait was cut down from a possible 5 hours to 1.5 hours. So everything worked perfectly. And some people, in fact, called the open line show. They said, wow, it was very orderly. My child didn't cry. The nurses were very helpful. And I really appreciate what the nurses did to us. So the government is changing the practices every day based on public opinion. Again, as the criteria loosened, more people benefited. And now they can relax the criteria to people with lung transplant, with diabetes, with cystic fibrosis, with diseases that are considered chronic. And if you're under 65, you can go there last week, anytime. And a lot of people did the same thing, and by end of last week, over 130,000 people have been vaccinated. And that's way over 23% of the population. And that's the #1 in nation. This week, we have heard on the news tonight, they have another 450,000 vaccines coming in. So people who have not been vaccinated, do not be afraid. You will have your turn. Can I ask, how many of you are afraid of the vaccine? Anyone? Anyone prepared not to have the vaccine? Okay, I'll tell you a story. For those who don't believe in the vaccine, hold out your right hand. Imagine if a 2-inch figure in your right hand. This is your negative thoughts. They'll tell you, if I take the vaccine, I may have neurological problems. I may get sick. I may even die. There was only one reported case of death so far in Canada. This is your negative idea. But why did you have that idea? Because you want to live and thought, if I did that, it would make me sick. Now, hold out your left hand. This is the positive thought. If you vaccinate, you have 5% of chance of getting the virus. If you do not do it, you have 38% chance of contacting the virus if you somehow get the bug. Do you want to hurt your family? Do you want to hurt your loved ones? Which hand is more important? The left hand. So think about it tonight. The left hand. You should, for the betterment of yourself, for the betterment of your family, for the betterment of your loved one, you should do that. Nice Christmas present, isn't it? This is the H1N1 virus receptor. It's deceiving, but this is actually the protein that binds the H1N1 to your organ. So this is not a good thing, even though it looks Christmassy, but they know when's a good time to attack. Now, the H1N1 virus also did a lot of things. It made the government become more transparent, as I said, and also look at the publicity. It did a tremendous marketing to community. You have received in your mailboxes, you have heard on the radio, you've seen on TV. Even children know how to deal with it. The big 3 C's: clean, cover, and contain. So if you visit hospital, if you visit all the department offices in the government, you'll see a lot of sanitizers around the building. Even kids, I see them all the time in the hospital. They go there and clean their hands. It has never happened before. The H1N1 incident, or called it, has changed the scenario of personal hygiene. People know how to respect hand washing. People know how to make sure that they clean their hands and wash their hands before they eat food. The public image has changed. Healthcare starts from prevention, and the government has done a good job in doing preventive medicine. And H1N1 is not the end of it, but we noticed that this virus actually is sort of dying down. Hopefully, this will be the beginning of the end of the second wave. But is it the end? I don't believe so. According to Boston, the big computer models, they put this data into the system and predict the future. All scientific trends are based on mathematical calculations. Do you know that when they first started, there was 1 death in March, and now across Canada, there are more than 260 deaths. There were 8 cases in March, now we have more than 10,000 cases of H1N1. So the virus is not really going away yet, and they predict there will be a 3rd wave coming by next spring. So for those people who are still skeptical, I tell you, the next wave will be even more deadlier and will make you even sicker. The symptoms of H1N1 is simple. Basic flu symptoms, cough, fever, but it comes fast, it acts fast. If it gets into your airway, into your lungs, you get lungs collapse, and you have what we call a respiratory distress syndrome. You can die from it. And there are mutations already noticed in Norway and Ukraine. And they found that these viruses now can actually cause bleeding in the lungs. It's not a good thing. So make sure you get your flu shot. Don't worry, lots of time. The government has enough vaccines to make sure everyone who wants to have it done will have it done. To end, I believe the body is feeble, the mind will not be strong. If you want to avoid sickness, then the best, this is a quote from Thomas More. He believes that if you can avoid it, it's rather than begging for medicine. And it's very true. Based on my observations, seeing the government has been transparent in these H1N1 cases, their recent dealings with the unions, their publicity on helping the deprived children, and on spending health care, bring us to number 2. All these events make me feel that our government, Newfoundland government, is doing the right thing. We're definitely moving forward in a positive, effective way to make sure our health care at least is improving. If anyone can admit their mistakes and move forward, they must be doing something right. Thank you.